So when I think about fatigue and I think about brain injury, some of the points that I usually make with a person is that typically after a brain injury, a person has less energy available overall to function, and oftentimes the tasks they take on have a way of being way more draining to them than they ever were prior to their injury.
So they start their day with less gas in their tank, even if they feel like they've rested well.
Yep.
Right.
And sometimes I'll ask a person, subjectively, if prior to your injury you had 100% energy available, where do you think you are now? I mean, sometimes people will say 40%. Sometimes it's less. There's no way to really gauge that on an assessment tool, but you know that it's different.
And it doesn't have to be things that you would think would be fatiguing.
No,
For instance,
not at all.
Early on in the treatment course, I think of a man that would wake up, shower, get dressed, and needed to rest. Because, and this is a different kind of tired. This is not just I kind of feel like relaxing.
Yeah, it's unrelentless. You can't push through this fatigue.
I can't think.
Your brain will shut you down. You will not have a choice in it.
I might just cry randomly.
Yeah.
Right? That type of
Yeah.
fatigue, which really hits people differently.
Sometimes it's choosing between I can either make food or I can eat food, but I can't do both.
Right.
I don't have the energy for both.
Yeah, and so family members understanding that, they see it in action, but it's sort of difficult to wrap your brain around.
Like, what's happening here? He went outside, he stacked wood for 2 hours, and then he came in and took a 45-minute nap. Why did that happen?
Right.
It's because the fatigue balance is significantly off because the person's brain is healing.
Yeah.
We need the energy available so they can heal the brain. We don't want the energy to be spent on things that are not as necessary. We want the healing to happen.
Right. And when you think about fatigue, that could be caused from thinking, right? That mental fatigue, could be physical fatigue, especially when people have a pain component. That's,
yes, headaches are very draining when it comes to pain and energy management.
A hole in their gas tank, right?
Yeah.
Just a chronic leach on resources. And then emotional energy, right?
I think sometimes too, when you have a loved one who suddenly is crying or angry, and it doesn't make sense, but it actually really does, because that person has just used up all of their energy, and the little bit that they had left is gone, and now they don't have the emotion or the energy available to keep their emotions in check anymore. Sure. And that's why that happens.
Yeah. And we certainly don't pretend to treat emotions.
No.
I mean, that's not our scope of practice. But one of the really cool trickle downs is when we see people managing their energy better, planning better, initiating those high cognitive tasks, those thinking tasks early in the day versus late in the day, and just sort of that working smarter, not harder, we'll see that that people are showing better emotional control.
Yes,
That's
because
a cool
you're feeling
trickle-down.
better.
That's a
yeah.
cool trickle-down.
Yeah. I think about one lady that I worked with who, she was really excited to exercise, which I agree. It's a great thing if you do it correctly. But unfortunately, when she was exercising, it became a drain on her resources, and she actually felt worse afterwards and needed a nap. So we had to have that talk about what's the amount of exercise that you can do that still gives you a boost of energy and is beneficial, versus actually something that's working against you and then making it harder for you to take on the demands of your day.
Don't you find too, Jody, that people, maybe she'd started an exercise regimen at one time previously, right? We don't specialize in exercise, but people would dial up really quickly. Maybe I was on the treadmill 10 minutes today and 20 minutes tomorrow and 40 minutes, and that sort of increase after brain injury, regardless of what that increase is, whether it's physical, cognitive, or emotional, that quick dial up doesn't work very well.
Has to be slow and incremental.
Yeah, we help pace that.
Yeah.
Really help people to know their brain well and to be an expert on their own brain, so that as they increase to get back to their day-to-day, they do it in a way that's safe,